All right, everybody, welcome back. You ready to get our hands dirty with another deep dive?
Always. I love getting into the nitty-gritty detail.
Me too. And today, we're going deep into the world of oral surgery.
Oh, excellent.
Yeah, we're going to be looking at a procedure called the Osseous Resection technique.
Okay.
Now, I know that might sound a little intimidating,
It does.
but trust me, it's super interesting.
I bet.
So basically, this procedure is all about reshaping the bone.
Reshaping the bone in the mouth.
Yeah, specifically to treat periodontal disease.
Ah, I see. So when the gums start to pull away from the teeth,
Exactly.
creating those pockets.
All right, and those pockets can be a real breeding ground for bacteria,
Absolutely.
which can lead to all sorts of problems.
Definitely. Infection, inflammation, even bone loss.
Exactly. And that's where osseous resection comes in.
So how does it work?
Well, it's kind of like sculpting.
Sculpting.
Yeah, the surgeon uses a variety of instruments.
Like what?
Oh, things like rongeurs, burrs, chisels, files.
Whoa. Sounds intense.
It is. It's pretty precise work.
I can imagine. You wouldn't want to slip up with those tools in someone's mouth.
Exactly. Precision is key here.
Yeah,
There's a lot of sensitive structures in there.
for sure. Tooth roots, nerves, blood vessels.
Right. And the surgeon has to be very careful not to damage any of those.
I bet that takes a lot of skill and experience.
It absolutely does.
So walk me through it. What are the steps involved in this osseous resection?
Okay, so the first step is called vertical grooving.
Vertical grooving. What's that?
So basically, the surgeon makes these thin vertical cuts in the bone.
Why vertical cuts?
Well, it helps to reduce the thickness of the bone
I see.
and make it easier to reshape.
Makes sense. So they're like slimming down the bone a little bit
Exactly.
to get it to the right shape.
Yep.
Okay, what's next?
So after the vertical grooving comes radicular blending.
Radicular blending. Okay, you're losing me a little here.
So basically, this is where the surgeon smooths out the rough edges.
Ah, I see. So after they've made those vertical cuts, they smooth everything out.
Yep. It's like sanding down a piece of wood.
Got it. To create a nice smooth surface.
Exactly.
And why is that important?
Well, it helps the gums to reattach properly.
Ah, that makes sense. A smooth surface is going to be much easier for the gums to grab onto.
Right.
Okay, so we've got vertical grooving and radicular blending. What's the next step in this osseous sculpting process?
The next step is called flattening interproximal bone.
Flattening interproximal bone. Now that's a mouthful. What does that even mean?
It sounds complicated, but it's really just about leveling out the bone between the teeth.
So it's like making sure everything is nice and even.
Exactly.
Why is that important?
Well, it creates a more stable base for the gums.
Got it. So it's all about creating the ideal foundation for the gums to reattach.
Exactly.
Okay, so what's the final step in this process?
The final step is called gradualizing marginal bone.
Gradualizing marginal bone.
I know it sounds a little technical, but it's a crucial part of the process.
Okay, break it down for me.
Basically, it's about creating a smooth, gradual slope from the teeth to the gum tissue.
So it's like a gentle ramp for the gums?
Exactly.
And why is that important?
Well, it helps to ensure that the gums attach in the right place.
Okay, that makes sense. So all of these steps work together to reshape the bone and create the best possible environment for the gums to heal.
Precisely.
Wow. It's amazing how much detail goes into this procedure.
It really is. But we're not done yet.
Oh, there's more.
Yeah. After the bone has been reshaped, the surgeon needs to reposition the gum tissue.
Ah, so they like pull the gums back down to where they should be?
Exactly. And then they secure them in place with sutures.
Sutures, like stitches.
Yep.
Wow, this really is like a mini construction project happening in your mouth.
It is. And just like with any construction project, there's a recovery period.
So what's the recovery like after this procedure?
Well, it varies from patient to patient.
Of course.
Right.
But in general, what can someone expect?
Well, there's usually some swelling and discomfort for the first few days.
Makes sense. It is surgery after all.
Right. And it's important to maintain good oral hygiene.
That's always important.
Absolutely. The surgeon may also prescribe a special mouthwash,
Oh, really? Like what kind?
one that contains chlorhexidine.
Chlorhexidine. What's that?
It's an antimicrobial agent.
So it helps to prevent infection.
Exactly. And it's important to go to all your follow-up appointments.
So the surgeon can make sure everything is healing properly.
Right.
So how long does it take for everything to fully heal?
Well, the initial healing takes about 2 to 3 weeks,
Okay.
but the complete maturation and remodeling of the tissues.
So the bone and gums fully adapting to their new shape?
Exactly.
How long does that take?
That can take up to 6 months.
Wow, so it's a pretty long process.
It is. but the results can be really amazing.
I bet. So you're basically giving people a second chance at healthy gums.
Exactly.
That's incredible. Now, considering how intricate this procedure is and how long it takes to heal,
Yeah.
I'm curious about the future of osseous surgery. Do you think there's room for advancements in materials or technology?
Oh, absolutely. I
Yeah.
think we're only just scratching the surface.
I'm really excited to see what the future holds for this field and for all the people who can benefit from these advancements.
Me too. Well, on that note, I think it's time for us to wrap up this deep dive.
Great deep dive. I learned a lot. Thanks for having me.
Always a pleasure. And thanks to all of you for listening. We'll see you next time on The Deep Dive.